COVID-19 cases and hospitalizations on the decline across the state as students return to campuses and classrooms. Here to speak with me about recent COVID-19 trends, Jefferson County Health Officer Dr. Mark Wilson. Dr. Wilson, thank you so much for your time this afternoon.
Good to be here. Thank you.
So, obviously, you keep a close eye on these trends. How would you characterize these recent numbers in cases, hospitalizations, and death numbers?
Yeah, there's still too many deaths, obviously. That lags behind everything else. But we're very encouraged by the numbers of new cases. Our percent positivity rate is now less than 5%. And our hospitals, while still very busy, are looking much better. So there's more capacity. So we have very encouraging trends now over more than a couple of weeks now here in Jefferson County and really throughout much of the state. So we still have a long way to go, though. I'm still not comfortable with the number of new cases per day that we're seeing. So we still have more work to do.
It stands to reason that as schools and colleges go back to work for the fall, what kind of infection rate were you expecting?
Well, we were really very concerned a month ago looking ahead to colleges and schools reopening because our numbers looked awful at that point. So now we're in a better position, which makes me more comfortable. But what we need to be very careful about is to be sure we don't let our guard down, to make sure that we have very strict precautions in place as we open schools and colleges back up to make sure that they don't lead to outbreaks that make us move backwards.
How much of the successful trend is a statewide mask order? How much do you think that had to do with it?
Well, I can't quantify how much it is, but it certainly looks like it made a difference. And I'm very pleased that the governor did that. It certainly seems to correlate with the timing of when that order was issued. So that's very encouraging. Again, I'm hoping she will renew that order because we need to not let up at this point. We need to keep up the good work.
That's a good point. It's set to expire on the 31st. Now in Tuscaloosa, they're taking strict measures to slow the spread after the kids came back to school and didn't seem to be paying attention to mask orders and social distancing. Do you perceive something like that needed here in our area?
Well, I hope not. It just depends on how everyone does. UAB started back classes, I believe, today, so we'll keep a close eye on how things are going. We just need everybody's cooperation, including our students, and I hope the same thing doesn't happen here that happened in Tuscaloosa, where we see crowded bars. We'll be keeping a very close eye on that, and I just want to encourage everyone in the public to keep working really hard with the social distancing, the hand sanitation, and the mask wearing, being very strict about that. We're making really good progress. We need to not let our guard down.
And final question, President Trump announced an emergency approval of an antibody therapeutic. How much of a difference do you think that'll make in COVID-19 treatment?
Well, the studies so far are incomplete. There's some encouraging signs, but we still don't have the results of really well-designed, placebo-controlled studies to tell for sure how well that works. We're very fortunate here that UAB is enrolled in some of those studies. A lot of people in the Birmingham area have already been receiving that treatment, but we have to emphasize that we need more data to really know how effective these therapies will be, and it's still a little too early to tell.
Dr. Mark Wilson, thanks again for your time and expertise as always.
Thank you so much.